Cool. Okay, I actually think this is great. Following up Lambdo, you're gonna spoil alert. The true heroes of this whole analysis are vets and veterinary knowledge. So what do you do when these case reports really are dubious at best? And we looked at it in the tick-borne virus system, which actually maybe has more information than influenza. So let's take a hypothetical vacation. Let's say I'm going to Italy to visit some family. I decide to go for a hike. Uh, I realize as a tick biologist, I realize I've been bitten by a tick and I need to monitor my symptoms. Um, I then develop noticeable symptoms. So I go to a local urgent care, but it's August in Italy. Everything is closed. But I do notice there's a note on the door that has his phone number. And so I pay all this money to make an international phone call. But then I realize I don't speak Italian. So I say ciao and bye-bye. So what happens to my hypothetical tick-borne virus case in this one scenario? As an ecologist, I'm really curious about ecological drivers of what's environmental suitability of ticks and their pathogens. But as a disease ecologist, I realize that disease risk does not exist without humans. And so what's been really fun with Sadie is that we've been kind of trying to link these two parts together, the ecology and epidemiology. And so in this first paper, we're really kind of focusing on the socio-economic drivers of tick-borne viruses, which is, a complementary idea to many other things going on in Verena, especially fingerprint. And then the second paper, we're diving really deep into the disease ecology and looking at two specific case studies of CCHF and TBE, which are just two common tick-borne viruses. And so philosophically, what is a number? I know that's kind of a silly way of phrasing it, but as public health, a lot of resources and urgency is determined by the scale of numbers. And so what do we do if these reported numbers, like Lambda was saying, they may not be telling the whole story? And this is not a new idea. Actually, there's been a lot of really great papers recently. Like I said, also Rory Gibbs' paper and many others, fingerprint, saying, the outbreaks may not actually represent true environmental risk. It may actually be representing socioeconomic factors such as access to healthcare. And so I came into this project, this kind of tick-borne knowledge. And to me, I think tick-borne viruses are especially tricky to interpret their case counts. They require a high level of knowledge by patient to physician. So patients have to know that they were in a tick area or have symptoms, and physicians need to recognize tick-borne viruses, which it's actually honestly the veterinarians who have more knowledge of tick and tick-borne diseases. Unless you have a hemorrhagic viral fever, they tend to be really non-specific. Like who doesn't feel, fatigued and achy? It's like Friday. I'm sure everyone's tired by this week, like whether you got bit by a tick or not. Diagnostic tests are not readily available, even in high resource countries. I'm sure you can talk to many people who try to get Lyme disease tested in the United States. It's very difficult to do. And although mosquito-borne diseases, they do cause the most mortality and morbidity in the United, and globally, in public health campaigns focus on mosquitoes. Mosquitoes are not ticks. Ticks are long-lived. Not a lot of their ecology is figured out, and they don't concentrate around water sources. It's not as easy to control and manage their population. So although it's great that public health campaigns are mosquitoes, we can't necessarily take those suggestions and then apply it to the tick-borne virus world. And then on top of all of that, just the surveillance data, we're really interested in Verena. It's how do we take advantage of surveillance data? Surveillance data in humans and non-human hosts is incredibly patchy. So how do we actually interpret tick-borne virus cases then? And so this first paper, aim and question, I've kind of broke into two ideas. If we do think there's this holistic thing that's driving tick-borne viruses from ecology to economics, socio-demographic factors, which country level characteristics appear more important of that kind of holistic viewpoint? And then secondly, because we have this assumption that it takes a lot of resources to recognize and diagnose and get treatment for tick-borne virus, do we actually see a higher probability of reporting tick-borne viruses in countries with more economic resources? Is this actually a thing? And so what we did is basically we selected right now as the most comprehensive, up-to-date database on tick-borne viruses called Zover. They also have mosquito viruses and bat viruses, but for ticks, it's decent. And so basically what we did is we went through the literature and we selected about 19 top tick-borne viruses of concern. But then when we restricted the analyses to 1990 to 2023, we remained about 14 tick-borne viruses, including African swine fever, Powassan, deer tick, a kind of a range of diseases that also range in their clinical symptoms and presentations. And so if a country had none of those 14 tick-borne viruses, it was assigned a 0, and it's beige in this map. But if it did have one of those 14s, it was assigned a 1, and it was some sort of this blue, and the blue represents intensity of records. And so you can see that here in Russia, they had a lot of individual records for tick-borne viruses. And like Sadie and I kind of talked about, some of the reasoning behind this is due to maybe possibly because of bioweapon research that was done. And there's a lot of interest in certain diseases for that aspect. But anyways, it's this whole other conversation. And so with this outcome, we decided to pair it with this like curated global trait matrix. We didn't want to throw the kitchen sink at this. Like there's a lot of people, especially I've seen a lot of tick mapping where people are just trying to lump in every single variable they can. But we wanted to go about this in a way that we had these latent variables that we think would actually represent the chain of events that leads to a reported case, such as environmental suitability, exposure risk, knowledge of ticks, access to healthcare, wealth to attain care, and then reporting structures. And so data, I think in the final model, we only have 23 variables, and they came from sources like CDAC and ACLID and GBIF. It's just kind of a variety of things. And because this is Verena, we threw everything in a boosted regression tree, so this group knows what those are. So thank you, Brianna, who also helped me with this. They're great for messy ecological data. And for this project, we were just kind of looking at variables of importance. So additional details to know is we did hyperparameter tuning, fivefold cross-validation. We did do an easy PubMed citation weight and ran those as Poisson models, and basically then create an ensemble. So the model metrics you'll see is of ensemble of about like 100 runs. And so big picture of this, if the null hypothesis is that reported cases to match up one-to-one to environmental risk, we should see more of this highlight green color and more of these bars. And although that this Köppen-Geiger climate zone is important, like it has to have a suitable environment for a tick, we see a bunch of different colors representing the different categories that we think are leading up to the chain, such as wealth, reporting, healthcare, exposure risk. So such as things like Gini index, livestock production, conflict exposure, living below poverty line, et cetera, et cetera. And I mean, this is not the world's best model. Like it has an ensemble AUC of 0.87, specificity of 90, but the sensitivity is really low. And it kind of makes sense. Like, you know, models aren't really good at predicting which countries don't have ticks, probably because ticks can live a lot of places, but that's what it currently is at. And so now if we're kind of moving to that second point, so, okay, we say, you know, there's a lot of different factors that make up the probability of having an infected reported case, like, you know, socio-economic. But do we actually see countries with more resources actually have a higher probability of reporting? And so what we see from these partial dependence plots is that country level characteristics that lead to the increased probability of reporting a tick-borne virus include having a low Gini index, which a lot of like Nordic countries do, increased pesticide imports. This one I want to shout out to Anna Fagre. She was really great where I asked Anna, I was like, hey, I'm trying to figure out covariate that can represent like country level veterinary knowledge. Vets are great for tick-borne diseases. Tick-borne diseases are a One Health problem. It's like, you know, but vets are really the ones that are working with people's like companion pets and livestock, and they have actual education to understand ticks. And so Anna suggested I go to this International Veterinary Student Association webpage. And on that webpage, I basically went to the directory. And if a country had a student chapter present, I gave it a 1. And if it didn't, I gave it a 0. And based on this partial dependent plot, it suggested that if a vet student chapter is present in a country, that country is more likely to report a tick-borne virus. I was kind of also reassured that I took a different data source. So this was from World Bank, percent of tertiary grads from veterinary, agriculture, forestry schools. If you increase the amount of graduates that come from those schools, you are going to increase the likelihood of reporting a tick-borne virus. Granted, not by a huge marginal effect, but still a positive direction. And then another one is kind of note, countries that have low percentage of population exposed to conflict are also more likely to report TBVs. If you meet the basic necessities of safety as like citizens, they probably will be more likely to report their infectious diseases. So some takeaways. For these multi-step diseases that require a lot of steps from like infectious contact to reporting, reported cases may not represent true disease risk. And I think a lot of us, you know, recognize this. And that although ecology is super helpful for understanding where disease risk may exist, non-ecological features may help put those reported cases into context. And this is like, I feel like another Verena statement, like hopefully open data sources and statistical tools will help us elucidate these patterns of disease and try to close this gap between environmental risk and actual risk within the human population. So with that, Thanks, Verna. It's been really great interacting with everyone. Sadie, honestly, so fun. I'm so glad we get to keep continuing our chats and everything for a long time to come, and looking forward to submitting these papers and sharing them more with the broader community. But yeah, thank you, Verna. Thank you, Bergen. It's been great.